Hey all, so I wanted to do a video because I've been promising to put one up. Um, I have been having a hard time trying to find the headspace to be able to make a video. Also, I have a toddler, so it's kind of hard to make a video when he's running around the house, and then at night I don't want to wake anybody up. So, there we go. Um, but yeah, so I'm making it in my car right now. But anyways, so I think I just want to do a basic rundown of like from the point of me getting to San Francisco and whatever I had to do before surgery, and then I'll lead you guys up to like maybe me leaving the hospital or a little bit after because I don't really remember a lot of the hospital. I do want to say that at this point, I'm going to talk about my experience as far as the hospital goes and what I personally went through. I will talk about my surgeons who are not really, they might be mentioned in this video, but my overall experience with my surgeons was amazing, so this really has nothing, like anything that I say that might not be like, not negative, just like maybe a minus, it's nothing to do with my surgeons, and I will explain about my surgeons and other things in other videos. So I want to try to make these quicker because I know everybody watches shorter videos than longer ones, and mine are normally long, but either way, here I go. So we ended up going to San Francisco, California. I live in southern Ontario, and so we had to get, our plane got delayed on the day we were supposed to leave, so that sucked. And then the next day we actually flew out, but we were supposed to have a non-stop flight. We ended up having a stop, so we had to go to Vancouver, and then from Vancouver we had to go to San Francisco, and roughly it was like a 15-hour day. Luckily, my toddler is amazing, and he was better behaved than like all of us adults, so that was really good. He was awesome on the ride home too as well. I'm just gonna put that out there. So we did that, got there, and then the first day, I don't think I really had anything to do. We just chilled, and then the next day I had to go for my pre-op with Dr. Safer, and I ended up doing that. He's super awesome. I won't focus on that too much. It was pretty much just a rundown of everything that was going to go on the next day. Or, sorry, on my surgery day. So I believe that was on the Wednesday or the Tuesday. And then I think it was the Tuesday, and then Wednesday I had to go get a blood test and a COVID test, so I went and did that. And then Thursday was the day where I had to take all those awesome medications that make your system empty out. I had to take Doculax, and I had to drink a full thing of Miralax. Most disgusting thing ever. Not a fun time. I thought if I mixed Miralax with, like, there was this cucumber melon Gatorade in the States, and like it was revolting, and I had already mixed my Miralax in with that, so I just like had to drink it, and it's actually really hard to do. It was so gross. Don't ever get that kind of Gatorade. It's not good. But yeah, so I did that. Then the next day I had to go in for surgery. It was earlier in the morning, so I was at the hospital like I think around 6 o'clock in the morning. I went in for surgery. It was around 9 hours when I was going into surgery. Like everything going into my surgery as far as the hospital was really good. It was decent and everything like that. I didn't really have any issues. So went into my surgery. My surgery had gone well. I was recovering. I was on a lot of meds in the hospital and also having difficulty because they were not allowing me to have my medication for my mental health. So I was really struggling in the hospital, and I slept a lot of the time, but when I was alert and awake, it was a rough time. My surgeon also said that I could take my medications and I didn't need to stop them, but in the hospital they just would not allow me to take them, and they attempted to give me like a different medication that was supposed to be like similar or the same as one of the ones I took, but it didn't really do much, so that sucked. The pain was pretty intense, but like I said, like I was out of it for most of the time. I know I posted a video when I was in the hospital that was decently coherent on my Instagram, and then when I got out of the hospital, I know I posted a video that, like, I don't even remember posting it. I was sitting on a lawn chair outside at the Airbnb and or laying on like a lawn chair recliner thingy, and I don't remember that one, so that was fun to watch and finding out I posted that one. But either way, back to the hospital. um, like I said, I don't remember too much. I remember being in pain. I remember the second night, I believe it was, I was throwing up a lot. um, they gave me a bowl to throw up in, and that just backsplashed everything everywhere, which sucked. And finally, a nurse came in that actually gave me one of those bags that you can puke in so you don't get stuff all over yourself. Because I distinctly remember actually puking all over myself. And like, it took a while for people to come in, and when they came in, when one of the nurses came in, she's like, we have other patients, so like you have to wait for us. And it was just one of those things where I was like, I am incoherent and I'm covered in my own vomit, and what if I like choked because I'm so out of it? Or like, what if, like, you know, it's just one of those things where it's like, and on top of that, like, everything on me is covered in puke. It's like, it's not like it's enjoyable or whatever, but I get it. But at the same time, it was just, to me, like, why do you gotta be like rude? Like, I'm clearly not having a good time, but all right. um I think it was like the second last night that I was in the hospital. um the nurses, like, to my recollection, I had some really good nurses. There were a few of them, but I also had quite a few nurses that were not great. So the second last night, I was just having a really rough time, and I was trying to like speak to them and tell them like I was supposed to go for a walk today, and nobody took me for a walk, and like I'm supposed to be like leaving on Thursday, and you're telling me that I'm not leaving till Friday, and like all these other things. So it was just getting on me. And then there were nurses that, like, sorry, I keep saying like, it's annoying me. Either way, I don't care if it's on my chart. Like, and generally, I'm not somebody who gets upset at being misgendered. Like, I'll just shrug it off, or I'll be like, no, that's supposed to be this, or like, I'll change it on the form. And I don't know, because like, I've had my stuff changed for forever. Like, it's been at least 7 years, if not more, that all my stuff has been legally changed. So it was starting to bother me because I kept on getting misgendered. And instead of just using my name or saying the patient, they kept on calling me her and she. And it was like, I'm already dealing with enough. And by you doing that, it's just upsetting me and pissing me off, because like, why do you gotta do that? At one, like, it got so bad that I literally said, like, I don't care what it says on my chart. I am laying here with my dick out, and I have no boobs, and I have a beard. So like, what are you doing that? And like, you're not supposed to be doing that, because this is supposed to be a hospital where you care for trans people, and like, you're not. So she ended up arguing with me, and there were a couple other nurses that were doing it too, and it had been building up over the week. So I actually ended up asking for my surgeons to talk to Dr. Safer, like, to if they could call him. And they got like really snooty with me and said they don't even know who that is, which is another like thing where I'm kind of like, you don't even know who my surgeon is, but you're caring for me. And if I ask for my surgeon, you're just like, I don't even know who that is. So it concerned me. And again, this has nothing to do with my surgeons at all. This has to do with the hospital. And so like, I ended up saying like, get the F out, because they were upsetting me that much. And I said, either leave me alone for the rest of the night unless I paid you, or get my doctor on the phone right now. So they got Dr. Safer on the phone, and he was going to come to the hospital to chit chat with me and see if he could make me feel better. But I told him, like, don't do that. Like, you're already home. Come, like, if you're able to, come see me in the morning, or if you call me in the morning, because I didn't want to inconvenience him, because it wasn't like I had a surgical issue. It was that issue. So that ended up happening, and he came. I talked to him a little bit. He made me feel better, and he came in the next morning, and we just had like a little chit chat, and it was really nice because, not that I want anybody to be upset. I don't want anybody to get in trouble. I don't want to make a big deal out of anything. But at the end of the day, I'm somebody who it's like, well, somebody else could be really upset by that, and a lot of people would be. So I'm gonna say something because it's happening so much to me, and so I'm gonna speak up about it because I don't know. And apparently they've really had no issues. So I don't know if there were some new nurses on the team or what it was, but I do know that Dr. Safer was really upset about it. It bothered him, and he was actually making a point to talk to the staff about it because of like how much it upset me. And if it upset me, being somebody who doesn't get upset by being misgendered as much, then we were just thinking about how much it would end up hurting somebody else, you know? So that happened, and then I stayed in the hospital, I think, for like one more day. And that the day after, like the day that I talked to Dr. Safer, I ended up going for like a short walk, but like the nurses didn't even let me walk that far. So it was like literally from my bed to the door. And I've seen where other people have like walked further. And it's not like I couldn't keep walking. She was just like, okay, that's fine now. So after that, I did go home. Like, we took a cab home. The people that took us down to the cab were really nice. I'm going to say that around 50% of the nurses were nice, and the other ones there were issues with. So for me, it was a bigger issue because I do have agoraphobia and a couple other mental health issues, but this is a necessary surgery that I need to have so that I can continue to work on myself. And the nurse that actually argued with me asked me point blank after I yelled at her, like, why are you even here then? And it's like, I just told you about my mental health and that I've been maintaining it. You guys don't want to give me the medications that I'm supposed to be on. You misgender me, and then you ask me why I'm even here. So that experience wasn't great. I'm not a fan of hospitals anyways. I did have to go in for a mini surgery because I ended up with a pretty decent sized fistula that was along the bottom of my phallus. I have been updating on Transfella's Instagram and on my own about little things like that have happened. I don't want to go into too much more just because it's going to verge on like my recovery at the Airbnb once we got out of the hospital, and also my interactions with the surgeons while I was healing and stuff like that. Little things that might have gone on. It's not too exciting because you don't get to do much. I really only got to get out the one day, and we didn't like go in anywhere. We just decided to walk from one surgeon's office to the other. It was like a 45-minute walk, so it wasn't terrible. But yeah, that was my experience in the hospital. Also, the like little bit of leading up to it. I really didn't go too in depth with the leading up to it and everything because there are a lot of people who have made videos, and it's pretty much, I went through the same thing. We went in, we had our pre-op appointments, which are fairly self-explanatory, and so that part I didn't really get into. If you do have questions, I will answer them for sure. You just have to comment below, and for each one of the videos, if I've missed things or I haven't answered questions that you felt you wanted answered, put them in the bottom, and at the end of all the videos, I'll end up doing like a random question or like random explanations for clarification. Anyways, I think this video is long enough, and I hope everybody's doing well. I also want to mention that like this isn't the experience of everybody. This was my experience, and I actually have not talked to anyone who's had this experience at the hospital. And like I said, nothing to do with the surgeons at all, nothing to do with Crane Center at all. But it was just the hospital that I was at, and I'm honestly gonna say maybe they did get new staff that hadn't had training or anything, or wasn't aware, or didn't pay attention during training. That's what I want to do. I want to give the benefit of the doubt that it was just maybe new staff that didn't get a proper training. So I don't want anybody to be worried that they're going to go for surgery and have to deal with that. I just wanted to explain that I had dealt with that and that it has been addressed and it is like definitely being it's being enforced. It's just unfortunately for some reason I didn't have the same experience. So yeah, anyways, this video's long enough. I know I already said that. I will talk to you all later. So have a great weekend, and I'll talk to y'all later. Peace.